Hello, my name is Colonel Sweet. I would like to talk to you about the nutrition portion of the performance triad. Good nutrition is absolutely essential for peak cognitive and physical performance. In the 1930s and 40s, many young people in America were malnourished due to the scarcity of food. Today, however, we are overfed and undernourished, significantly reducing our performance and literally killing ourselves with poor eating habits. Consider these statistics. Fewer than 15% of our soldiers, our service members, consume 3 or more servings of fruits, vegetables, or whole grains in a day. The military health system spends nearly $4 billion each year in medical costs associated with obesity. We spend almost $300 more a year for each individual who is receiving medical care and is overweight, and nearly $2,000 more for someone who is obese. Although obesity rates among active duty and their beneficiaries are slightly better than the national average, the number of veterans who are overweight, obese, and have diabetes is actually worse than their civilian counterparts. Greater than 70% of VA beneficiaries are overweight or obese, as compared to 63% of the general population. The prevalence of diabetes in the United States general population is 7%, whereas it's 20% among our VA patients. These statistics are shocking and clearly emphasize that as we transition to a system for health, we must improve our eating behaviors. We have clear evidence and access to information about recommended dietary intake for health and performance. The purpose of this brief is to inform you, the healthcare provider, on how the nutrition component of the performance triad relates to patient care. During this brief, I will discuss available assessment tools, nutrition prescriptions for health, resources, dietary supplements, and then provide guidance for nutrition referrals. So, have you ever wondered if everyone really does know what good nutrition looks like? Why don't more people eat better? If we know how to lose weight, why does the rate of overweight and obesity keep increasing? Eating well is not just knowledge. The environment must support the eating behaviors. Now ask yourself, what am I doing to help my patients eat better? Are you modeling healthy eating behaviors? Are you referring your patients for medical nutrition therapy? So let's talk a little bit about assessment tools. Currently, the Tri-Service Workflow AIM form only addresses obesity. However, many diagnoses have a nutrition component, such as diabetes and dyslipidemia. As a healthcare provider, you are in the ideal position to talk to your patients about weight control, nutrition, and/or their eating habits. Ask patients about their eating habits with questions like, what kind of foods do you eat? Or what does eating for performance or healthy eating mean to you? How many servings of fruits and vegetables do you eat per day? Or do you skip meals? So what's the nutrition prescription? Eating well supports enhanced cognitive and physical performance, weight management, disease prevention, healthy aging, and muscle repair, growth, and maintenance. Science has shown us that many diseases are related to chronic inflammation and that the foods we eat affect inflammation. It's important that we all eat a variety of foods to ensure that we get the optimal amounts of nutrients that promote health. As a healthcare provider, you should encourage patients to eat more whole fruits and vegetables, whole grains, lean proteins, low-fat dairy, and to choose healthy fats. These are all foods that can help reduce inflammation and have been linked with lower risk of chronic disease. In contrast, you should encourage patients to eat fewer processed foods, foods that have added sugars and fats, refined grains, and foods that have low nutrient density or empty calories. These foods are associated with increased inflammation and increased risk for chronic diseases. An excellent basic tool that anyone can use to encourage better food choices is the My Plate concept. My Plate suggests having half a plate of fruits and vegetables at each meal, along with small portions of protein, whole grain, and dairy. Planning regular meals and snacks is essential to maintaining energy level, improving endurance, and increasing metabolism. Encourage patients to plan their meals and snacks for the day, including regular fueling every 4 to 5 hours. Meals should be planned in conjunction with activity and sleep so that cognitive and physical performance is optimized. In order to refuel efficiently after exercise, encourage patients to eat a snack that contains both protein and carbohydrates within 30 to 60 minutes of strenuous exercise. Some excellent examples of good refueling are chocolate milk, a peanut butter sandwich, or string cheese and a piece of fruit. Most people don't drink enough water and are chronically dehydrated. Hydration is essential to physical performance, but also for mental performance. A recent study published in March of 2011 in the British Journal of Nutrition found that a level as low as 1% dehydration, as measured by change in body weight, had adverse effects on cognitive function, such as slowing of working memory and increased tension, anxiety, and fatigue. Encourage patients to consume at least 8 glasses of water a day and more if they are exercising regularly. On a side note, sports beverages are good options to encourage optimal hydration, but are most beneficial when the patient exercises for 60 minutes or more at a time. And energy drinks should never be used for rehydration. Healthy weight is not just a recommended number on a scale or a body mass index in the healthy weight range. It also takes into consideration where body fat is stored. Patients who carry their weight in the abdomen, or those who are considered to be apple-shaped, are at a higher risk for chronic disease than overweight patients with a healthier weight distribution. The most commonly used method for classifying an individual as overweight or obese is the body mass index, which is based on body weight and height. However, BMI has limitations and can lead to the miscalculation of certain individuals, such as those with increased muscle mass or those who are elderly. Waist circumference may be a better indicator of health risk than BMI alone, especially when used in combination with BMI. It is particularly useful for individuals with a BMI of between 25 and 34, and a high waist circumference, more than 35 inches for women and 40 for men, is associated with increased risk for developing chronic disease. A tool that is becoming increasingly more common is the waist-to-height ratio. A person's waist should be less than half of their height for a ratio of 0.5. For example, someone who is 66 inches tall, their waist should be less than 33 inches. This tool is especially helpful for people who are shorter or taller than average. Studies show that talking with patients about weight control or eating habits help promote behavior change. Research has shown that patients who are counseled by their primary care provider about the benefits of healthy eating and physical activity often take positive action. They lose weight and they exercise more than those who did not receive the counseling. Find out what motivates your patient to change. Disease prevention often doesn't resonate or motivate change. However, having enough energy, looking and feeling better, and performing better in all areas of life may be more appealing. Recommend patients use technology to assess their eating habits for at least 3 days. Often recording food and beverage intake helps patients identify areas that they need to improve. Ask them what they discovered about their eating habits during their next visit. Recommend gradual changes and ask if they have a plan. Encourage patients to replace foods high in fat, refined grains, and or sugar with healthier options. Provide them with resources for more information. Refer patients to dietitians or registered dietitians to assist with development of a personalized eating plan to help them meet their personal goals or assist with managing a health condition. An estimated 15% of active duty Army soldiers are enrolled in the Army Body Composition Program. Not only is meeting the standard a condition of employment, when left untreated, overweight and obesity can lead to costly diseases such as diabetes, hypertension, dyslipidemia, cardiovascular disease, and low back pain. Furthermore, obesity increases the risk of musculoskeletal injuries, which inhibits performance and overall readiness. Numerous studies support the use of medical nutrition therapy for weight management. The nutrition clinic at your facility offers weight control counseling for beneficiaries that are referred for health care or those who self-refer. An update to AR 600-9, the Army Body Composition Program, was recently published, and the requirements for nutrition counseling have changed a bit. We encourage you to familiarize yourself with the latest changes. Currently, Army Move, the Army's evidence-based weight management program, is offered at select nutrition clinics. This program consists of 10 sessions held as individual or as group encounters. This comprehensive lifestyle modification program incorporates a team-based approach with dietitians, physical therapists, and psychologists. The goal of the program includes weight loss, body fat loss, body fat loss, reduction in waist circumference, maintenance of weight loss, and then removal, ultimately, from the active duty body composition program. Let's talk a little bit about resources. There are a number of resources out there to help you get more information for yourself and your patients on nutrition. There are many websites, there are mobile applications that are available to you as a provider and then for your patients as references. This slide and the next slide list some examples of sites and apps that may be helpful to you in your own education and as you treat your patients. The new Army Medicine website will feature links from the Performance Triad, which will include videos on topics of interest such as how to use apps, how to refuel, meal planning, grocery shopping, and others. Many of these websites have information available for free for you to give to your patients. There are a variety of apps available to help monitor and analyze intake. Many studies have shown that by simply writing down what you eat, you will eat less and make better choices. With the ability to have the app automatically analyze the diet for you, there's no reason why not to take advantage of them and recommend that your patients use them. One suggestion is to have them use them before they come to visit you for their next appointment, so you can either help them with their eating plan or refer them to a registered dietitian. Dietary supplements. Soldiers often turn to dietary supplements due to the extreme demands of mission performance. Unlike medications, most dietary supplements have not been rigorously tested for their benefits and their side effects. We always recommend whole foods as the best source for an edge on performance. As a healthcare provider, it is important to be aware of any dietary or nutrition supplements a patient may be taking, as many of the supplements may be harmful and may have interactions with the medications. Part of helping patients make smart, informed decisions include knowing how they may interact with the patient's prescribed and over-the-counter medications. Help patients make informed and safe decisions about their dietary supplement choices by visiting Operation Supplement Safety. A registered dietitian can also assist a patient with making informed decisions on the use of dietary supplements and how to make proper food choices to improve performance, health, or to manage weight. In addition, it is imperative to report an adverse event or an adverse reaction to a dietary supplement if you discovered that your patient may have experienced one. You can report adverse events on the Operation Supplement Safety website. This is a screenshot of the Operation Supplement Safety website. You notice there is a frequently asked questions section and sections for both the warfighter and the provider to provide resources to help you and your patients make informed choices. The site also offers an Ask the Expert service in case the desired information is not available on the site. In addition, the HPRC offers a continuing education course on supplements for DoD healthcare providers. Also available through the HPRC website is the Natural Medicines Comprehensive Database. This database is a very useful and informative website that has a portal for both consumers and for professionals. Access to this database is at no cost for DoD and military employees. You are able to search the database for supplement ingredients to learn details such as effectiveness, other common names, and interactions with other supplements or medications. The database also offers multiple free continuing education courses and another website where you can report adverse events. So let's talk now about when and where to refer patients for more information. As I've already mentioned, there are a number of nutrition-related diagnoses that would indicate referral to a nutrition expert, the registered dietitian. RDs provide medical nutrition therapy for patients with significant risk factors and identified disease or who need advanced nutrition expertise. Medical nutrition therapy is linked to improved clinical outcomes and reduced costs related to physician time, medication use, and hospital admissions for people with obesity, diabetes, disorders of lipid metabolism, hypertension, and other chronic diseases. Medical nutrition therapy can improve a patient's health and well-being, as well as increase their satisfaction through decreased hospitalization and reduced prescription drug use. Some of the most common diagnoses include, but are not limited to, overweight and obesity, especially, as we mentioned before, those with a high abdominal circumference, which puts them at higher risk for chronic disease. Hypertension and cardiovascular disease. Dyslipidemia. According to the clinical practice guidelines, diet intervention should be the first step in lipid-lowering therapy. For every $1 spent on medical nutrition therapy, we save over $4 on statin drugs and reduce drug-associated side effects. Diabetes is another diagnosis, especially newly diagnosed, anyone who hasn't seen a dietitian in at least a year, or patients who are experiencing poor blood sugar control. A recent study at one of our NTFs showed that only 16% of newly diagnosed diabetics were referred for medical nutrition therapy. And also patients with food allergies or intolerances. It's also appropriate to refer beneficiaries that may have specific nutrition interests, such as sports or performance and vegetarian diets. Many installations have an Army Wellness Center, and it's important to note that Army Wellness Centers focus on primary prevention in well patients and can provide basic education in nutrition, only basic information on nutrition education for weight loss. In summary, most Americans, and the Army is not immune, have poor nutrition habits. Very much encourage you to talk to your patients about their eating habits. Encourage them to eat 8 servings of fruits and vegetables per day. Refer them to the Army Move program for those who either don't meet the standards or are within 1% of meeting the standards. Find out what motivates your patients to adopt better eating habits and help them make informed, safe decisions on supplements. And then don't forget to refer individuals for any nutrition-related diagnosis to a registered dietitian. Thank you.